When we entered the year of the nurse and midwife in 2020, how many of us could guess at the challenges we would now face, as individuals, professionals, countries, and as humanity? As a profession, we have more in common now than at any other time, being asked to respond with greater leadership and professional capabilities, and for many of us to be closer to the front line than we would have ever imagined, being part of the global fight against the coronavirus. There has never been more public support and goodwill shown to nurses, midwives, our healthcare colleagues and key workers in our time. And this is because of your willingness to step forward, to act together, to care and support for those who needed it the most. Talking to colleagues around the world has been inspiring, sharing ideas, practice, tips, providing working solutions to our daily challenges, dealing with each other's anticipation and apprehension, whilst all the time managing the contrast of the rapidly increasing pace of our roles with our own periods of self-isolation, particularly if living away from family in order to protect them. As individuals, we may feel trepidation of what is before us and what is asked of us, but look how much you have already managed to adapt to the challenges, and look at how resilient you have been. In our living memory, this has never happened before. However, we are united in working to see the end of this shared episode in history. This time is ours to make of it what we will. You are critical in the fight against the coronavirus, and if asked on how we as nurses should act, I would answer, be the best you can be and be the best for each other. As we spend our time being extremely busy, preparing, grasping our ever-changing strategic and operational plans, researching, training, and for many, encountering our first patients with coronavirus, look around you at the professional bond and support you have for each other. And if you feel overwhelmed, think of this. Focus on what is in your control, acknowledge your thoughts and feelings, come back into yourself and engage in what you're doing. Look after yourself and look after each other. Seek help when you need it. Seek help for your colleagues when you see they need it, whether it's physical or psychological. What you are doing is amazing. We will look back and say how proud we are to be a member of this profession at this most challenging time. To all of you, stay safe, stay well, be kind to yourselves and be kind to each other.